Welcome to Ask the Doctor. I'm Aimee Gutierrez, your host, and I have the privilege of introducing you to our subject and the doctor who will be addressing it. We have quite the show in store for you today. We'll be having a conversation about something that seems to be affecting more and more individuals by the day, and that's diabetes. We've invited the author of the book, Diabetes Undone, to share some insights, world-renowned physician Dr. Wes Youngberg. Thank you, Dr. Youngberg, for taking the time to join us. And before we go into what could be wrong with us, we want to hear from you. What's right with us and how are you today?
Well, I can answer both of those questions by saying the most amazing thing about the human body and why I feel so right today, so good today, is that we are designed to heal. So those of us that are struggling with conditions that have been called irreversible, you're going to have this for the rest of your lives. Think again, because our bodies are designed to heal. Our job is to figure out how to do that most effectively.
Now, when it comes to diabetes, there's just so much to discuss. But to kick things off for our audience, can you explain in simple everyday terms what diabetes actually is and how it is affecting our body?
Diabetes is defined by one thing alone, and that is having a blood sugar that is high enough to cause what we call polyopathies. That's just a fancy medical term for many different types of chronic diseases or complications. And so when blood sugars reach a certain point, and it was actually in 1997, while I was still practicing lifestyle medicine, we discovered that the diagnosis for diabetes was coming after the diagnosis of its complications. So we recognized that the blood sugars were already way too high. They were already causing complications. So we needed to change the diagnosis to a lower level. So in the United States, that level went from 140 blood sugar to 126, or in the Canadian unit standard, that went from 7.8 millimoles per liter down to 7.0. And so for the last almost 30 years now, we have had a better way to diagnose it early to try to catch this condition before major complications begin. And those complications are nerve damage or neuropathy that can lead to amputations, or the lack of feeling in the feet. So you don't even know when you stepped on a tack or you have a big sliver in your foot and it festers and you might end up losing your entire foot because of a gangrenous infection.
I had a question from what you were sharing there. With the levels, is that where prediabetes comes in, or how does that fit into the levels that you're discussing?
So also in 1997, doctors said, hey, we need to come up with a new diagnosis that comes even before diabetes. And they coined the term prediabetes. Prediabetes is defined by a blood sugar that's elevated, but it's not quite high enough to be called diabetes quite yet. And so the millimole per liter level for prediabetes is basically a 5.6, or by US units, it would be 100. So if the blood sugar is above 5.6 with Canadian units, or above 100 with US units, that's officially prediabetes. Now, there's another way to diagnose both prediabetes and diabetes that's actually more sensitive than the fasting blood glucose, or the fasting blood sugar as we typically call it. And that's looking at the blood sugar at 2 hours after the beginning of a meal, or after the beginning of taking in a sugar drink of any kind. If your blood sugar's 2 hours from the beginning of a carbohydrate load of any kind goes above 200 for US units, or above 11.1 in Canadian units, that is officially diabetes. But prediabetes occurs at 2 hours if your blood sugars are above 140 US standard, or above 7.8 on the Canadian norms.
Thank you for sharing that. What are the main types of diabetes? I know there's type 1 and type 2 and gestational. And how do they differ in terms of causes and who they typically impact?
Yes, the type 1 diabetes is really a form of diabetes that is typically caused by significant exposure to toxins or an infection, a very acute infection. Oftentimes, type 1 diabetes is in a young individual and in a child, and that child has gotten sick and has become very acutely ill, and that virus, like the Coxsackie virus or other virus, basically it does so much damage to the pancreas, to the very cells in the pancreas, the beta cells that make insulin, that now the ability to produce insulin has been destroyed, like almost 100%. And so that's where those individuals, they develop very, very high blood sugars in the severe to critical level. And the only option for them to effectively control their blood sugars is actually to take insulin, because the body needs insulin to control blood sugar. In a type 2 diabetic, the problem is the diagnosis is the same. It's based on the same symptoms and the same blood sugar levels. The difference is that the pancreas is still functioning at a very high level. It can still produce a tremendous amount of insulin, but in this case, the body, the muscle and the liver and other cells of the body have become very resistant to the work of insulin. So even though the pancreas is making a lot of insulin, it's not working that well, and the blood sugars go up anyways. And so when the blood sugars go up for any reason, that's diabetes or pre-diabetes, okay, but there's different reasons for it. So that's why type 2 diabetes is by far the most common form of diabetes out there. And it's the type of diabetes, when we say we can reverse diabetes, or in my book where I say Goodbye Diabetes, How to Reverse Diabetes Naturally, we're talking about type 2 diabetes. Now, one thing that's really interesting, Aimee, about the different types of diabetes, and even a lot of doctors don't appreciate this fact, that people with type 1 diabetes can actually also develop type 2 diabetes. And by that I mean, even though their primary problem is they can't make any insulin, they can also become severely insulin resistant, which is the main underlying cause of type 2 diabetes. So they can end up with both conditions, the lack of producing insulin and the lack of the sensitivity to insulin. So that's why somebody needs more than, let's say, 30 units of insulin a day. They're actually also insulin resistant. So they're actually also have a tendency to type 2 diabetes. And that form of diabetes, even in a type 1 diabetic, is reversible. They're still going to have type 1 diabetes, but they're going to be able to use a lot less insulin to get the same impact on their blood sugars. And then there's actually a couple other forms of diabetes. There's gestational diabetes that we can talk more about, which is simply a diabetes that develops during pregnancy. And so this happens in people that are more prone towards type 2 diabetes. This may be a woman that before pregnancy had maybe an early form of pre-diabetes that went undiagnosed so far. Okay, but as soon as they get pregnant, they're starting to gain weight from the pregnancy, they develop more insulin resistance, and all of a sudden now they meet the criteria for high blood sugars and basically diabetes during pregnancy or gestational diabetes.
This is fascinating information. So you commented about how often with type 1 diabetes, people don't pay attention to their diets or think that there's much they can do about it. But you commented that type 2 diabetes can actually come out of or can come alongside of type 1 diabetes. Should people be aware of that in trying to prevent getting type 2 diabetes if they already have type 1? And how would they go about it?
Great question, Aimee. That's a great question. So yeah, absolutely. And so when the reason I discuss it that way, and I discuss it with my type 1 diabetics all the time, and it's a new concept to them because typically most doctors don't think of that. they say, well, you have the worst type of diabetes is type 1, and so we're just going to treat it as type 1. But a lot of people are smart, and so if they just think this is a question of blood sugar control, which by the way is very important to have blood sugar control, but preventing disease associated with diabetes is far more than just blood sugar control. Okay, so if somebody says, well, they're type 1 diabetic, so they have to take insulin in order to regulate their carbohydrate intake. They learn that, hey, if I want to eat twice as much today, let's say I went to my party day and I'm going to eat twice as much, or I'm going to have a big old frappuccino, okay, and with a lot of sugar in it and caffeine, my blood sugar is going to go up, but I just up my insulin dose and bring my blood sugar back down. So one of the mindsets is that, hey, I just use as much insulin as I need to control my blood sugars.
What's one mind-blowing fact about diabetes that most people don't know, perhaps something you've seen in your research or clinical experience?
I spent 7 years operating a gestational diabetes clinic. And one of the things that as I prepared for those clinics every Wednesday morning, working with these women who, wanted the best for their babies, wanted to optimize their blood sugars, I learned something really powerful. And that is that 75% of the risk of their baby later on as an adult becoming diabetic is determined epigenetically by how well they control their blood sugars during pregnancy. Now, that really is a mind-blowing fact, because you got to kind of step back and really digest that information. Like, what? Wait a minute. 75%, the majority of the risk of that baby that's born to a mother with gestational diabetes, the risk of that baby developing diabetes when it's an adult actually comes from how well the mother controlled her blood sugar during that pregnancy. So this is why we said if there's ever a time where you want to really pay attention to all the health principles and do your very best to be as healthy as possible for yourself, but especially for your baby that's growing in the womb, their exposure to high blood sugars, okay, means that their little pancreas that's not even 10% developed yet is now having to go to work.
It's crazy to think that so much of that will depend on what a mom does during her pregnancies. I'm excited to hear more about that coming up and about the tips and ideas to be able to manage our diabetes or other lifestyle factors. We're going to take a quick break and jump to some questions that came in locally that we want to hear from our viewers.
Hey doc, I like to keep things simple. If I could only incorporate one lifestyle habit to reverse my type 2, what's the one habit I should incorporate?
Check your blood sugars 1 or 2 hours after the beginning of a meal, and then add exercise right after the end of the meal and look at the difference. And you will be convinced that you'll have a dramatic improvement in your blood sugars if you just do a light exercise immediately after finishing the meal. Because otherwise, your blood sugar is going to reach its high point before you do any exercise. Now it's already done all the damage it's going to do.
A follow-up question with that. A good light walk or something similar, is that what you would recommend for exercise right after a meal?
Yes, the simplest mild to moderate exercise. We're not talking about get sweaty exercise. We're not talking about getting short of breath exercise. We're talking about just going outside and enjoying nature, going for an easy walk. You can do that inside if the weather doesn't allow being outside. And just do every minute that you walk or move your body or do some vacuuming, do some sweeping. Every minute that you do that immediately after finishing a meal, you can lower your blood sugar significantly.
This is from Martha. I was told that I'm pre-diabetic. Does that mean I need to give up my salted caramel ice cream?
Well, Martha, sometimes we have to say no to things we really want to do or eat in order to say yes to the best of things. So, you know what I would do in your case? I would get a continuous glucose monitor and check what happens to your blood sugars after you eat your party meals, right? I mean, I like those, party foods as much as anybody. But what motivates me, Martha, is that when I actually check my risk factors, in this case, my blood sugars after a meal, it motivates me to come up with a shorter list of what is best for me. So if you want to have for a birthday or a special occasion over the holidays, a little bit of a treat, pumpkin pie over Thanksgiving, whatever it might be, then make sure that you go for a walk after the meal, right? So that can help make up for that blood sugar rise that you otherwise would have had.
Diabetes has seemed to explode the last few decades. How has that surprised even experts like yourself? And what hidden factors are fueling this epidemic?
We have been learning for the past several decades that diabetes is more than just being overweight and sedentary, even though those two factors are huge contributors to metabolic syndrome, insulin resistance, and prediabetes and diabetes. And yet we've seen some big studies demonstrated the amount of toxins that we're exposed to have a much higher risk factor than obesity or even a sedentary lifestyle. So we need to consider all the factors. And we've also recognized that infections are big problems in driving diabetes.
Now, in your book, Diabetes Undone, you dive into root causes. Can you share an intriguing example of how everyday habits might be secretly contributing to insulin resistance?
There are many habits, and I would say, one of the more obvious ones is when somebody drinks a lot of sweet teas or sweet drinks. Those are the more obvious ones. The more exposure we have to any type of sweetness, especially if it's carbohydrate related sweetness, the more our pancreas has to work in order to produce more insulin to compensate for that rising blood sugar that otherwise is causing damage. See, when the blood sugar goes up after a meal or a snack, every time it goes up, part of that sugar irreversibly glazes to proteins all throughout our body.
I had not heard it described that way. That's a very insightful way to understand how insulin works and how our blood works around that. Prediabetes affects millions without them realizing it. What are some quirky, overlooked symptoms that could be red flags for our viewers?
Well, one of them is just looking at central fat gain. So, we've gotten used to that. In fact, the majority of adults, basically more than 2/3 of adults, have extra fat in their midsection. By removing excess fat in the midsection, you're dramatically altering your risk of this metabolic insulin resistance syndrome that leads to type 2 diabetes.
Busting myth time. People love to blame sugar for everything diabetes related. What's a surprising non-sweet culprit that's just as guilty?
Well, the fundamentals or the foundational principles that drive damage to the pancreas and insulin resistance are the lack of exercise, the lack of the appropriate nutrients, and the lack of appropriate sleep or rest. Though those are the three most fundamental strategies. Of course, there's many other fundamental strategies as well. But so sometimes we blame the sugar, right? And understandably, if you have a monitor, a blood sugar monitor, and you check your blood sugar before and after a sweet drink of some kind or a ice cream bar, the blood sugar is going to be much, much higher than it's going to be after eating a salad.
A little bit earlier, you talked about how cortisol and stress can play a part into diabetes. How does this sneakily sabotage blood sugar levels? And do you have a fascinating patient story that illustrates it?
Yeah, Amy, I got some great stories for you. What's really interesting about cortisol is we tend to vilify cortisol because it's the stress hormone, and excess stress is definitely bad for diabetes, definitely bad for it causes high blood sugars, no question about it. One of the reasons that people are so amazed at the fact that they can have higher fasting blood sugars first thing in the morning than they do 2 hours after a big meal. So they're like, wait a minute, how come I haven't eaten anything for 12 hours and my blood sugar is higher then than it is a couple hours after meals? Now, not everybody's like that. Most people are going to be higher after a meal than they're going to be before a meal. Okay, but one of the reasons that many people, I would say a significant minority of my patients, will actually have a higher blood sugar before breakfast is because the cortisol is being overproduced, and that's, by the way, that's typical. You're more likely to have high cortisol between 6 and 9 a.m. in the morning than any other time during the day, unless, of course, you're majorly stressed at one of those time points. So as cortisol increases, the body, the liver, will actually allow sugar to leave the liver cells, the hepatocytes, and go into the bloodstream. Without cortisol being present, the liver cannot release sugar. So with somebody who actually has a problem with adrenal fatigue, which is very common, they cannot release sugar, even though their liver has 3 to 4 pounds of sugar waiting to be released, because they can't produce enough cortisol, which is the opposite of Cushingoid syndrome, or similar on the way towards Addison's disease, where your adrenals can't produce hardly any cortisol. But a lot of people have a mild problem with that, and that's really bad for the immune system. But so is too much cortisol.
So I have a question for you. You talked about the continual monitoring of blood glucose. How do people go about doing that? Is it something they should speak with their doctor about? Is it something everyone should do? What do you recommend on this?
With it.
If somebody has at least stage 3 high blood sugars, which is the beginning of pre-diabetes, or they have diabetes, right? I always recommend that they check their blood sugar some way. Okay, and the most convenient way to do that is with a tab that just hooks up to your upper shoulder for upper arm for 2 weeks straight. So you don't have to poke your finger at before and after every meal, even though that's actually a very accurate way to do it. Okay, but a lot of people don't like to poke their finger, right? So just having something that's on your arm, you don't feel anything, it's just sitting there, it's just a little tab that's hooked up to your arm, and it is sending the information to your smartphone every 15 minutes. And so you can quickly see how high your blood sugars are under any circumstances. That's extremely valuable. Once again, it puts you in control. There are different products available on the market. There's the Freestyle Libre, there's the Stelo from Dexcom, and there's even the Dexcom G6 or G7, which in the US, those are prescription only. But in Canada, I understand they're over the counter. And so you can just get it. You can just go get it and just talk to your pharmacist and say, I would like to get a continuous glucose monitor, and start checking your blood sugar.
Dr. Youngberg, nutrition is a cornerstone in Diabetes Undone. What's the most entertaining aha moment you've seen when patients switch to a whole food plant-based diet?
I think of my patient, Tom. He was 89 years old. And I'd done a comprehensive labs on him, and he had out of control diabetes. And he was a multimillionaire, He was the chairman of the board of many organizations. And I remember he brought his open hand down on the table and smacked the boardroom table where we were meeting. And he says, "What are we going to do about this?" And I said, "Tom, I'm glad you asked." So I shared with him the concepts that we're talking about by checking his blood sugars and going for a moderate walk right after the meals, and then changing his diet to a whole plant-based diet, lots of non-starchy vegetables. And so, he was a very successful person. He'd made countless of millions of dollars in his lifetime, and he knew how to be successful. And so he just said, "Okay, I'm going to figure out what to do. So you just tell me what to do and I'll do it." So we told him what to do, and he started incorporating that into his lifestyle. And 5 weeks later, I'm serious, 5 weeks later, he called me up and he said, "Well, Doc, I want to get checked again." I go, "Tom, it's only been 5 weeks, man." And he goes, "I know, but it's my 90th birthday next week, and I want to be able to tell everybody who attends my 90th birthday gala that how well I'm doing." Do you know that in those 5 weeks, he'd already reversed his type 2 diabetes? He's 90 years old.
No way.
Never
Wow.
say to me that you're too old to reverse your diabetes. That's just simply not true. And I remember him saying to me, he says, "I was praying." He says, "I didn't pray that God would heal me. I prayed that God would give me the resolve to make the changes so that I could reverse this condition."
That's incredible. What a great ending. We started this conversation talking about the severity of issues that can come from diabetes and how much it can affect our lives. And to end on a note of a person who has completely reversed it and gotten years back on their life just by following a few really simple techniques is so incredible. This should give hope to all of our viewers that are watching at home. Dr. Youngberg, that was so informative. Thank you for taking the time to explain everything in such a profound yet practical way.
Thank you so much for having me. It was fun having this discussion.
If you've enjoyed this week's episode of Ask the Doctor, please join us next week as the conversations are still going on. If you'd like, you can even be a part of them by submitting your questions to askthedoctor@3abn.ca. Thanks for joining us, and we'll see you next time.